Welcome. Today we'll explore adolescence, a time of remarkable growth and transformation. We'll look at the key changes that shape young people as they move from childhood to adulthood. Understanding this journey matters for parents, teachers, and healthcare professionals alike. Your insight can help support, guide, and celebrate teenagers through these important years. Let's begin this journey together. Puberty is a biological revolution starting between ages 8 and 14. Deep in the brain, the hypothalamus releases a hormone that transforms a child's body. For girls, this means breast budding and growth spurts. For boys, testicular enlargement and voice changes. This hormonal storm also alters how teens process emotions and respond to stress. Their internal clocks shift too, making them biologically wired to stay up late and sleep in. This isn't laziness, it's biology. Now, let's peer inside the adolescent brain, where perhaps the most fascinating changes of all are occurring. For decades, we assumed teenage behavior was simply the result of raging hormones. But modern neuroscience has revealed something far more complex and extraordinary. The teenage brain isn't simply an immature adult brain. It's a unique organ, optimized for very specific developmental tasks. To understand this, we need to look at two crucial brain regions that develop on different timelines. First, there's the prefrontal cortex. Think of it as the brain's CEO. This region, right behind your forehead, is responsible for planning, impulse control, considering consequences, and making rational decisions. Here's the key point. This area doesn't fully mature until approximately age 25. Yes, 25. Meanwhile, the limbic system, the emotional, reward-seeking part of the brain that includes the amygdala and nucleus accumbens, reaches peak activity during early adolescence. This creates what neuroscientists call a developmental mismatch. Imagine driving a Formula One racing car with a powerful, finely tuned engine, but brakes that are still being installed. That's essentially the teenage brain. The dopamine-driven reward system is hypersensitive, making everything from peer approval to risky behaviors feel intensely, irresistibly rewarding. Meanwhile, the still-developing prefrontal cortex struggles to apply the brakes when needed. Now, before we judge this as poor design, let me share something remarkable. This isn't a flaw, it's an evolutionary feature. This exact configuration drives adolescents to do precisely what they need to do developmentally. Explore their environment, take calculated risks, form intense peer bonds, and ultimately, separate from their parents to establish independence. Dr. Sarah Jane Blakemore at Cambridge has shown that teenagers actually demonstrate enhanced learning when rewards are involved. They adapt more efficiently than adults to new environments. They're more creative, more willing to think outside established patterns. That problematic teenage brain? It's actually optimized for innovation and adaptation. But there's another crucial process happening: synaptic pruning. During adolescence, the brain undergoes massive reorganization. Think of it as a use it or lose it process. Frequently used neural pathways become stronger and more efficient through myelination, whilst unused connections are eliminated. This means that what teenagers do during these years literally shapes their brain architecture. The teenager who practices piano 3 hours daily, those musical neural pathways are becoming superhighways. The one who spends those hours on social media? Different pathways entirely. This isn't about judgment. It's about understanding that adolescent experiences have profound, lasting neurological impacts. So, what should we expect from teenagers? Development happens in stages. Early on, expect black and white thinking, intense mood swings, and a focus on peer acceptance. Middle adolescence brings risk-taking and a stronger push for independence. They aren't rejecting you, they're just figuring out who they are. By late adolescence, emotional stability increases and family relationships often improve. These patterns are a necessary part of healthy development. Adolescence can unveil the impacts of early childhood trauma which may have been hidden for years. With new cognitive abilities, teenagers may suddenly grasp the full horror of their early experiences. Trauma fundamentally alters brain development, leading to emotional dysregulation, relationship difficulties, and hypervigilance. Most concerning are the risk behaviors. These aren't bad choices, but attempts to regulate overwhelming emotions. Yet this period of neural plasticity also offers a critical window for healing. With trauma-informed support, recovery is possible. Adolescence is when many forms of giftedness flower, but we must look beyond traditional academics. Howard Gardner's research shows potential manifests in wonderfully diverse ways. Consider the teen with exceptional interpersonal intelligence, or the one who sees mathematical patterns everywhere. But giftedness in one area doesn't guarantee excellence in all. Some are twice exceptional, gifted, but also with learning differences. Our identification methods often miss these diverse abilities. Without support for their unique needs, many gifted students hide their talents and underachieve just to fit in. How do we distinguish a normal teenage phase from one needing professional help? The key is 3 factors: persistence, pervasiveness, and impairment. Normal moodiness comes and goes, but when low mood or anxiety persists for weeks, affecting home and school and significantly impairs daily functioning, that's a red flag. The crucial message is, when in doubt, seek professional evaluation. It's far better to check than to miss a critical opportunity for early intervention, which is often remarkably effective. Now, we cannot understand adolescent development without considering the broader context in which it occurs. Every teenager develops within multiple overlapping contexts that profoundly influence their journey. Cultural background shapes everything from how independence is expressed to how emotions are regulated. In some cultures, maintaining close family ties throughout adolescence isn't just expected, it's essential for healthy development. The American ideal of teenage independence might be seen as abandonment in collectivist cultures. The expression of distress varies too. Some cultures encourage emotional expression, others value stoicism. What looks like emotional suppression in one context might be appropriate emotional regulation in another. Poverty, housing instability, and food insecurity create stressors that can exacerbate normal adolescent challenges or mask genuine mental health needs. The teenager who seems lazy might actually be exhausted from working nights to help support their family. The one who appears inattentive might be preoccupied with very real survival concerns. Research shows that economic stress during adolescence affects brain development, particularly in regions associated with emotional regulation and executive function. Yet these young people often show remarkable resilience and practical intelligence that our traditional assessments miss. Today's teenagers are navigating something entirely unprecedented: adolescence in the digital age. Social media provides connection and community, especially for marginalized youth who might not find acceptance in their immediate environment. But it also creates unprecedented opportunities for comparison, cyberbullying, and sleep disruption. The average teenager checks their phone over 100 times daily. They're managing multiple online identities, navigating complex digital social hierarchies, and facing judgment from potentially thousands of peers rather than just their immediate circle. Gender identity and sexual orientation exploration, increasingly visible in today's adolescents, represent normal developmental processes for many young people. Research shows that supportive environments dramatically improve outcomes for LGBTQ+ youth. However, without support, these young people face significantly higher rates of mental health challenges. LGBTQ+ teenagers are 3 times more likely to attempt suicide, not because of their identity, but due to minority stress, discrimination, and rejection. Academic pressure, particularly in high-achieving communities, can transform normal stress into anxiety disorders. The teenager facing 5 hours of homework nightly, pressure to excel in multiple extracurriculars, and constant competition for university places isn't just stressed, they're in survival mode. Conversely, schools implementing trauma-informed practices, later start times aligned with teenage circadian rhythms, and social-emotional learning can provide protective factors even for at-risk youth. So what does all this mean for those of us working with adolescents? Let me offer concrete, actionable guidance. Educate young people and families about typical adolescent changes. Reduce shame around normal struggles. But maintain clear pathways for help when needed. Create environments where seeking help is seen as strength, not weakness. The UK and US health services now recommend anxiety screening for all adolescents ages 8 to 18 and depression screening from age 12. But screening without adequate follow-up is worse than useless. It identifies problems without providing solutions. Ensure support systems are in place before screening begins. The adolescent brain's plasticity means early intervention can prevent lifelong difficulties. Cognitive behavioral therapy for emerging anxiety can prevent it from becoming entrenched. Trauma-focused treatment for those with adverse childhood experiences can literally rewire traumatized brains. Appropriate academic acceleration or enrichment for gifted students can prevent the underachievement and depression that often emerges when potential is unrecognized. Don't wait for problems to become severe. Early intervention during adolescence is like compound interest. Small changes now yield enormous benefits later. Individual interventions aren't enough if systems remain problematic. We need school start times that align with teenage circadian rhythms. The research is clear that later starts improve academic performance, mental health, and even car accident rates. Trauma-informed educational practices that recognize behavior as communication. Culturally responsive assessment methods that recognize diverse expressions of both struggle and strength. Accessible mental health services. The current average wait for child and adolescent mental health services is unacceptable. Parents, teachers, and others supporting adolescents need support themselves. Compassion fatigue is real. The stress of supporting a struggling teenager can fracture marriages, burn out teachers, and exhaust even the most dedicated professionals. Create networks of support. Provide training in adolescent development. Normalize seeking help not just for teenagers, but for those caring for them. Adolescence, for all its challenges, is a period of extraordinary potential. The teenage brain, with its heightened plasticity and intense emotions, is perfectly designed for forming identity and preparing for adulthood. Yes, they'll make questionable decisions, but these same characteristics fuel their creativity and passion. Our role is to provide scaffolding, seeing the remarkable transformation occurring within. The adolescent journey is messy and non-linear, but it's a privilege to witness. Our job is to provide the support and faith in their potential that allows them to navigate this transformation successfully.